Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Uterine cancer. Introduction. Uterine cancer is a common type of cancer in women. The two primary types of uterine cancer are endometrial cancer and uterine sarcoma. This program will focus on the most common type of uterine cancer, which is endometrial cancer. Endometrial cancer begins in the lining of the uterus. The lining of the uterus is called the endometrium. The earlier uterine cancer is detected and treated, the more likely are the chances of a successful treatment. This program will help you better understand what uterine cancer is and what treatment options are available. The female reproductive system. The uterus is a part of a woman's reproductive system. The reproductive system is made up of organs involved in producing offspring. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The uterus is a hollow, pear-shaped organ. It is about 3 inches long and has 3 layers. The inner layer of the uterus is called the endometrium. The endometrium lining grows and thickens each month to prepare for pregnancy. If a woman does not become pregnant, the lining flows out of the body. This is called a menstrual period. As menopause approaches, periods become irregular and eventually stop. Menopause happens when the ovaries quit making hormones and releasing eggs. The uterus has 3 parts: the fundus, the corpus, and the cervix. The fundus is the top of the uterus. It is shaped like a dome. From the top of the uterus, the fallopian tubes extend to the ovaries. When an egg is released from an ovary, it goes down to the uterus through the fallopian tube where it may be fertilized. The middle part of the uterus is the corpus. This is where a baby grows. The narrow lower part of the uterus is the cervix. The cervix is the passageway to the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. Uterine cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a uterine tumor may grow through the uterus's outer layer and nearby tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the uterus will always be called uterine cancer, even if it spreads to other places. Endometrial cancer is the most common type of uterine cancer. Endometrial cancer begins in the lining of the uterus or the endometrium. Rarely, cancer can form in the muscle or other tissues of the uterus. This type of uterine cancer is called uterine sarcoma.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. It is usually impossible to specify the cause of cancer in an individual patient. However, we do know what causes cancer in general. Doctors also know factors that can increase the chances of getting cancer. These are known as risk factors. One known risk factor for uterine cancer is the abnormal overgrowth of the endometrium. This is called endometrial hyperplasia. Women who are obese have a higher risk of developing uterine cancer. A woman's reproductive and menstrual history can also raise her risk for developing uterine cancer. A woman's risk is higher if she had her first menstrual period before age 12, never had children, went through menopause after age 55. The risk of uterine cancer is higher among women who used estrogen alone, meaning without progesterone, for many years as menopausal hormone therapy. Women who took the drug tamoxifen to prevent or treat breast cancer are at an increased risk of uterine cancer. Women who have had radiation therapy to the pelvis are also at an increased risk of uterine cancer. Family history affects a woman's risk for developing uterine cancer. Women with a mother, sister, or daughter with uterine cancer are more likely to develop the disease. Also, women in families that have an inherited form of colorectal cancer called Lynch syndrome are at an increased risk. Not everyone who has risk factors for uterine cancer develops uterine cancer. Some people who have no risk factors for uterine cancer can still develop the cancer. Symptoms. The most common symptom of uterine cancer is abnormal vaginal bleeding. It may start as a watery, blood-streaked flow that gradually contains more blood. After menopause, any vaginal bleeding is abnormal. Common symptoms of uterine cancer are abnormal vaginal bleeding, spotting or discharge, pain or difficulty when emptying the bladder, pain during sex, pain in the pelvic area. These symptoms may not be caused by uterine cancer. Make sure to see a doctor to find out what is causing your symptoms. Diagnosis. The best way to treat uterine cancer is by finding it very early. If you have symptoms of uterine cancer, your doctor will try to find out if uterine cancer is the cause of your symptoms or if there is another cause. Your doctor will ask you about your family medical history in addition to your own. You may also have blood tests to rule out other causes of your symptoms. A physical exam will be performed. A pelvic exam is helpful in diagnosing uterine cancer. A pelvic exam allows your doctor to check your uterus, vagina, and nearby tissues for any lumps or changes in shape or size. An ultrasound may also be done to diagnose uterine cancer. An ultrasound uses sound waves to create pictures of the uterus and nearby tissues. The pictures can show a uterine tumor. A transvaginal ultrasound may create a better view of the uterus. For this type of ultrasound, a probe is inserted into the vagina. The probe uses sound waves and their echoes to form a picture of body organs. A biopsy is a removal of cells or tissue for examination by a pathologist. A pathologist will examine the tissue under a microscope to look for cancer cells. A biopsy is the only sure way to know if cancer cells are present. If cancer is found, the pathologist studies tissue samples from the uterus under a microscope to learn the grade. The grade of the tumor tells how abnormal and aggressive the cells are. Tumors with higher grades tend to grow faster than those with lower grades. Staging. If you have uterine cancer, your doctor will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. When staging uterine cancer, doctors want to find out whether the tumor has invaded the muscle layer of the uterus, whether the tumor has invaded tissues outside the uterus, whether the tumor has spread, and if so, to what parts of the body. If you are diagnosed with uterine cancer, there are some tests that doctors can use to help determine if and where the cancer is spread. Certain lab tests can be helpful in determining if the cancer has spread. A Pap test can show whether cancer cells have spread to the cervix. Blood tests can show how well the liver and kidneys are working and whether you have a high level of CA-125, which may indicate cancer. A chest X-ray is helpful in showing if uterine cancer has spread to the lungs or chest area. An X-ray is a type of high-energy radiation that can go through the body and onto film, making a picture. Tumors can show up on a CT scan. A CT scan is an X-ray machine linked to a computer. A CT scan takes a series of detailed pictures of your organs. You may be given an injection of contrast material to make abnormal areas easier to see. An MRI is also used to make detailed pictures of areas inside your body. It uses strong magnets to create images of the inside of the body. You may receive contrast material by injection to make abnormal areas easier to see. In most cases, surgery is needed to learn the stage of uterine cancer. The surgeon removes the uterus and may take tissue samples from the pelvis and abdomen. Treatment and supportive care. The type of treatment used depends on the stage of the disease, the grade of the tumor, and the health and age of the patient. Treatment for uterine cancer may involve surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, immunotherapy, or some combination of these treatments. Surgery is the most common treatment for women with uterine cancer. A hysterectomy is when the surgeon removes the uterus, cervix, and nearby tissues. The ovaries, fallopian tubes, nearby lymph nodes, and part of the vagina may also be removed. Radiation therapy is an option to treat all stages of uterine cancer before or after surgery. It also may be used for women who do not have the option of surgery. Radiation therapy uses high-energy rays to kill cancer cells and stop them from growing and spreading. External radiation comes from a machine that aims the rays at a specific area of the body. Internal radiation uses radioactive liquids to treat specific areas. This is done by placing a narrow cylinder that is loaded with the radioactive liquid into the vagina. Chemotherapy may be used after surgery with radiation therapy or alone. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy is usually injected into a vein. The drugs enter the bloodstream and can reach cancer cells throughout the body. Hormone therapy may be used for women with advanced uterine cancer or for women with early uterine cancer that still want to get pregnant. Hormone therapy is an option if lab tests show that the uterine tumor needs hormones to grow. To counteract the hormones that make the tumor grow, other hormones may be given. The most common drug used for hormone therapy is progesterone tablets. Targeted therapy targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Immunotherapy, or biological therapy, fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Uterine cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, to relieve the side effects of therapy, and to help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Uterine cancer is a common type of cancer in women. The two primary types of uterine cancer are endometrial cancer and uterine sarcoma. The most common symptom of uterine cancer is abnormal vaginal bleeding. It may start as a watery, blood-streaked flow that gradually contains more blood. After menopause, any vaginal bleeding is abnormal. The earlier uterine cancer is detected and treated, the more likely are the chances of a successful treatment. Treatment for uterine cancer may involve surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, immunotherapy, or some combination of these treatments. Research already has led to advances that have helped people live longer, and research continues to find better ways to care for people with uterine cancer. Thank you for using Explain.